Welcome to Chapter 9, where we will be discussing the surgery of the liver and the extrahepatic biliary tract. We should start with a functional anatomy. Let's begin. And there is no better way of doing that than by doing this activity, which was a quiz last year. Get a piece of paper or get your phone out and identify if these statements are true or false. If it is false, also note what exactly is incorrect with the statement. Take as much time as you need by pausing this video on my mark. Ready, set, pause. So, are you done? Good. Because there's a 6 to 10. Again, take as much time as you need. Play the video after you are done answering. So do you have your answers with you? Let's see if you got it right. Number 1 is true. Though some might argue that the skin is the largest gland because of its secretory functions, I would ask you to read the statement again. I said in the body, not on, meaning inside the body. So the answer would be the liver. Yes, it is the largest gland. Number 2 is true or false? False. It is actually the reverse. The cranial surface of the liver is concave, while the caudal surface is convex. How about number 3? That is actually true. As an adult animal ages, the liver becomes smaller. Number 4 is false. The same with number 5, which is false as well. These two are actually the reverse of each other. Majority of the hepatic blood supply comes from the portal vein, which is a part of the hepatic portal system. The portal vein drains the abdominal organs, which means it is carrying nutrient-rich blood, but not in oxygen. It is low in oxygen. That's where the hepatic artery comes in to supply the 20%. This blood carried by the hepatic artery is oxygen-rich, which meets the high oxygen demand of the hepatocytes. Are you ready for 6 to 10? Let's find out. So, number 6, is it true? Yes, it is. Number 7 is true as well. Number 8 is actually true. Specifically, the gallbladder is supplied by the cystic artery, which is a branch of the hepatic artery. So this is still true. Number 9 is, you still remember the statement? I'll show it. The common bile duct of dogs and cats drains into the major duodenal papilla. That is true. However, number 10 is false. How so? In dogs, this statement is true. The accessory pancreatic duct would drain into the minor duodenal papilla. But in cats, it's a different story. The accessory pancreatic duct merges with the common bile duct, and then together they empty into the major duodenal papilla. The cats do not have a minor duodenal papilla. So again, this is an anatomy review, and it's very important when we discuss surgery of the liver and the extrahepatic biliary tract. The liver is divided into how many lobes? This should be instant, right? 6. Namely the right lateral, right medial, quadrate lobe, left medial, left lateral, and the caudate lobe, which has 2 processes. It is positioned on the cranial abdomen with its cranial surface directly in contact with the diaphragm. That is why its cranial surface is also called the diaphragmatic surface. The caudal surface, on the other hand, is also called the visceral surface because it is in contact with the visceral organs. A normal liver would have sharp edges and only become rounded in young animals, and those with livers with infiltrations, congestion, or scarring with fibrous tissue. We will discuss the biliary anatomy in the lecture videos later. For now, we are going to focus on the liver.